Well, hi. This is the time traveler with my faithful companion here. Um, in my efforts, I've been, researching about Medicare, wandering around YouTube, and of course, beginning to really look at the Medicare.org or Medicare.gov, where, there's the basic PERMA, that's the basis, and then there's all these people that do commentary. But I've been watching videos by the guy who does Medicare School. It's a YouTube channel, and he seems to be very fact-based. And very knowledgeable. I mean, he definitely impressed me without any problem. But as I look, as I am studying it and looking, I started with the Part D and looking at the number of drugs on which people depend. And of course, again, I'm not knocking it. The healthcare system has provided longevity. The question is cost, I hate to say it, cost and quality of life or functional level. And I don't know, people back in the day used to say an ounce of prevention is worth a pound of cure. I don't know, that wasn't such a bad folk wisdom back in the day. And again, in my, perusals of the information out there, I came across this Medicare School tape where he told about the incidence of diabetes in the U.S. population. I believe he was talking about 2024. But it just blew my mind because, of course, diabetic medication is a big piece of the action in terms of the Medicare Part D. It's one of the top chronic conditions. Now, the thing about this top chronic condition, I'm not a doctor, I'm not a nurse, I'm not a medical professional, but my understanding is that some percentage, at least a worthwhile percentage to make an effort to reach, some percentage of our chronic conditions that we know and love so well, because now we can live on with them at great cost in more than ways than one. But what if we were to be able to prevent even a fraction of it, okay? Because I guess what blew my mind most, I saw this, what he quoted that in terms of, let's just say, how can we put it? In the 25 to 64 year category, that is people who are not yet ready to go into Medicaid. In the United States, there are 100 million diabetics, pre-diabetics, okay? So we're talking 25 to 64, 100 million pre-diabetics in the United States. That was like 24. What if we could prevent even a quarter of that in terms of just by what we lovingly call lifestyle interventions? Because diabetes is a rising chronic condition which brings with it many other susceptibilities, shall we say, in terms of other body systems that are affected because the blood, the various organs are impacted. Then I looked at, in the United States, again, on Medicare, there are about 38 million diabetics, of which 4 million are, the type 1, which is, I guess, some inborn issue as regards to glucose metabolism or whatever is involved with diabetes. But the vast majority are people who could possibly benefit from the various boring lifestyle interventions at an earlier stage so that the most egregious manifestations of the condition are modified, postponed, eliminated. I don't know. Again, I'm not a doctor, I'm not a nurse, but if you could give yourself a shot wouldn't you want to try to take it? Just saying. Because, of course, he then went on to all the other secondary conditions that, like, once you have diabetes type 2, then you're looking at 3 times more incidence of coronary artery disease, okay, like heart attacks, strokes, yada yada, right? Obviously, neuropathy, which is like becoming an industry, it seems, okay, and then, of course, the stress on the kidneys in terms of all of that going on, which then adds to issues. And again, I guess it's the peripheral blood vessels that get somehow messed up as a result of the glucose imbalance, whatever. So the organs, the systems of the body are not getting the proper nutrition, stimulation, whatever, waste management, all the things, that we don't think about it, but there's a lot that goes on behind the scenes as far as anybody's human body is concerned. So in any case, and then I forgot the foot problems, and of course that can lead to amputation, wound care, so what blew my mind, I took these scribbled notes, okay? That was in 24, $413 billion on diabetic care. That's this is in the Medicare sphere now, because that's, all of the, not only the original medications, etc., but it's all the other services, shall we say, that are required by the healthcare system as a result of the negative impact of diabetes on the body. So the average, what he's saying is the average American, or I guess on Medicare, costs about $85,000. Their medical bills are about $85,000. That's pretty. What was that one? Okay, all together, it's about $413 billion a year. Okay, medication, yada yada, and so this is another. I was jotting things down. I impressed myself with the notes that he actually was distributing these facts, but 55% of people with diabetes are Medicare eligible. That is 21 million people. Okay. So we're spending a lot of money. We're giving people a length of, lifespan. And that was another thing he mentioned. It just blew my... Now diabetes takes 6 years, about 6 years off your life expectancy, which is, I don't know, he was saying that if you reach 65, your chances are now up for women about 85 to get to 85, and for men, for half of men, and half, there is a triage that goes on here, and half of men to get to 82. So, the lifespan has continued to increase, and there's more and more outliers. As I've mentioned before, the hospital center here, the Center for Healthy Aging, says that the 90-plus age group is the fastest growing in our community. So we are looking at a lot of people. And then I found another article, because, I forgot, did I mention it? Dementia is another possible side effect of diabetes. And I suppose it all has to do with the blood circulation, impairment of the organs being properly tended to. When your organs don't get their needs met, you start to get into trouble. But then, this is the part that's hard. Healthy habits / genetic dementia risk in adults with type 2 diabetes. Now, this is this is another study, and this is nothing, and this is not a big scientific breakthrough, but now it's becoming more and more evident that what we're calling lifestyle interventions can have a salutary effect on these chronic conditions and their manifestation. So what do they, I hate to say it, I hate to tell you this. What did they say? There's 8 factors that are, they're calling life's essential 8s, okay? Take note. 1, eat better, okay? 2, be more active. 3, quit tobacco. 4, get healthy sleep. 5, manage weight. 6, control cholesterol. 7, manage blood sugar. And 8, manage blood pressure. Now, these are for people who already have diabetes, so they too could engage in these activities, and even while having an expression of the disease, they can actually, by their own behavior, possibly improve their outcomes. So this is what has been substantiated by research, although we know this all along, that there's work to do, that aging is not easy as a job. Everyone has their choice as to what they actually want to do. But because it has such tremendous financial implications brought on by longevity, it really is something we have to think of very, very carefully, especially the middle class who depends on the intergenerational transfer of wealth. So just think about it. What would be helpful to improve your physical functioning, and is it worth doing? So this is a time traveler. Take care, have fun.